Brazos County is one of our counties that we cover, has over 300 cases that they've seen within their county, and it's one of the higher. It is the highest number within our viewing area, but it's up there, one of the higher numbers in the state. What can you say about anything that needs to be changed or ways to help in those areas?
I would say we need to be vigilant. We need to be careful. And whether you're in Brazos County or whether you're in Waco, Texas, we seem to be transit points. People up and down 84, back and forth in 84, and up and down on I-35. And we still need to be careful about what we do, washing our hands, keeping our hands away from our face, but more importantly, wearing our masks and taking the personal responsibility that is necessary. This is a lot of personal responsibility. To families who feel like they're safe together, I would encourage them, please practice the same types of safety inside the home and groups of people that they would out in the public. And that's how we protect ourselves. The bottom line to this is we're trying not to burden the health care hospital entrants so that they are able to accurately and quickly turn around protocols that are necessary to save people. But in that process, it is rapidly evolving. The virus is rapidly evolving, and we can protect ourselves by personal responsibility and doing the right thing, and then hoping that our healthcare advocates quickly learn new procedures and new processes to spot these things early on.
As this state starts to open up and other states have started, do you feel that there's any added responsibility to take precautions or stay in place or try to return to normal?
I believe that a return to normal will not happen, but I believe that we must take the personal responsibility, wear our masks, clean our hands, social distancing, and open back up the state. Once again, I am for opening back up the economy of Texas. I am for personal responsibility, and I believe that we can effectively, if we do that, not place ourselves at an additional burden. But our hospitals are as in McLennan County, we have no one in the hospital as of yesterday. Our hospitals are virtually shut down. Medical care, elective surgeries, dentistry, things that people want and need as they live their life, those are being held in abeyance. And I believe we've got to find a way safely to get back to opening up our entire economy.
There's been talk about the November elections being moved to a mail-in ballot format only. What do you think of that?
I think a mail-in ballot format by state law only allows those that would not be in the county, for instance, students, or 65 and above, and I am not for changing those requirements, and the legislature would have to meet to do that to follow the law. So unless the legislature comes back in, I do not see where we would be making those kinds of changes.
So here in the state of Texas, you don't foresee a mail-in ballot only system?
I do not, because that is not prescribed in the law, and the law is set by the legislature, and the legislature has not made those changes yet. So you have to follow the law. We do not have a royalty system where someone can unilaterally make those decisions. It is based on the law, and the law has not changed yet. And I would be against changing that law at this present time.
Good. That's all the questions I have. Is there anything else about your campaign or anything that's going on or that you're doing that you want to talk about?
I am delighted to engage the voters on the topics and the issues, and those very clearly are about the economics of the country. They are about bringing back small business and free enterprise. They are about the concern that people have about their own health care, about their own family finances, and it's caused a time for us to be very inward in some of our thinking. And I think objectively a lot of people are prepared to make the tough decisions to coordinate themselves and their family and their activities safely with a mask, but to be able to move on with their lives, and I think we've got to do that. Secondly, big questions abound, not just here in Waco, where we have Baylor University, but also southbound in College Station, where Texas A&M is, and I think that any changes to alter that university setting would not be in the best interest at this time. I believe Texas A&M and Baylor and lots of other small schools, community colleges certainly that we have, need to be aware of what the rules and regulations of social interaction should be. But I am for our young students going back to college and going back to Texas A&M. We would certainly caution that and temper that with, please don't go home. Go to college, get your education, stay on the campus, and be safe, and try and isolate those things. We're dealing with something now called herd immunity, and that herd immunity happens biologically, and when enough people have the antibodies and have been around to protect themselves. We don't know how that's going to play yet, but I am willing to take the risk that we must turn this around. Social distancing is critical, but that we should not economically ruin Baylor University, nor Waco, nor Texas A&M, nor Bryan College Station. I believe that we can effectively be careful and cautious and move forward with our lives and have our institutions survive also, and I think we can do that.
With post-secondary schools like those, most of, probably 95% of all in the students are the least likely to be affected medically by this. But you have faculty and staff who may be older in age and are more susceptible to illness. What do you say, what advice or do you have anything to say about schools opening back up and those varying degrees of age groups that are involved in the school?
I think that a person who might be older or who might be in a zone that would be considered susceptible to the virus more easily, they would have to make their own individual decisions, but I think we're going to have to learn the balance of responsibility, personal responsibility, washing our hands, interaction, and I believe that can be accomplished. I believe that when it has sneaked up on people and attacked them without their knowledge because they were not prepared is how this has happened. I don't know that it has happened when people practice social distancing, masks, washing their hands. I think it's when people got casual. We can't be casual with this virus. Just cannot be casual at all. And I think we'll be all right.
With your campaign to be able to reach your constituents, how are you able to still talk to people, interact with people?
It's been something that has been interesting. A lot of people are focusing on their own activities, and that is what you would expect. They are not interested in politics. I don't have the silver bullet or the answer. I've respected them. We have left people alone. We have interacted with the people who have sought our input or advice or information. And I think that as we get into now this last 60 days, there will be a focus. We will see certainly mail, we will see TV and radio ads, and people's attention will then focus on that.
Okay, perfect. That's
Great.
all the questions
Thank
I
you.
have.
Appreciate you, Doug.